Hi, Dr. Esho here, and I'm in association with Glamour magazine, and today we're talking about legit lips. Have you got legit lips? Or what does that even mean? Well, it's a question I always ask my patients when they come in and see me, because unfortunately, I can ask a girl, and 10 times out of 10, if I say, what bag do you have? They'll know the make, the style, the year it was released. But if I ask you, what filler do you have in your lips? It's always, Juvederm, son, I don't really know. So this is the reason why we decided to do the Legit Lips campaign. And I'm glad to have Glamour magazine today involved in this, because it's an issue that's important to my heart. Many times I get people coming with boss jobs to my clinics, and it's not because they haven't done their research, but sometimes they've just been a bit naive. It is something that is new, it's something that is scary, and if you're not told what you need to look out for, you can end up in the wrong hands. So with the Legit Lips campaign, I'm going to give you 3 short things that you can remember all the time to ensure that your lips are legit. So 1, make sure you are seeing a medical practitioner. You may think, oh, well, that just makes any sense. But a lot of the times, especially in the UK, unfortunately, non-surgical aesthetics like fillers and Botox are unregulated, which means anyone, including you who's watching this, can just inject anyone and there'll be no legal consequence. 2, make sure it's within a clinic setting. Unfortunately, there are practitioners out there that are practicing in unsanitary conditions, even in the back of gyms or even on a home sofa, yeah, believe it or not. And in those situations, there's a high risk of infection. And if you can get infection in your lips are not legit. Number 3, please know what's going into your lips. Like I said, you'll know what bag you're buying and what make and what fabric and material, everything about it. Even when you purchase a meal at the restaurant, you'll read that card and know exactly what you're about to eat. These products are about to be injected in you, so you should know what is going in there. When the practitioner shows you the box, he can show you, or she can show you, that it's either FDA approved or CE marked. These are 2 big markers of quality. If they're not able to do that, or you do not recognize that product, walk out of that room. Because just as in a restaurant, if you didn't know what you were gonna eat or what you were gonna spend on a bag, if you didn't know it was legit, you want legit lips. So keep safe. So today I have with me the lovely Laura. You can see her shoes soon, they're sick, you can see these. But she came to see me just to get a simple lip augmentation. Now she had this done before, but again, when I asked the question initially, what's gone in there, I got that, not too sure. And unfortunately, when I examined the lips, they weren't in the best of shape, but we'll show you in a moment why. But I want you to hear from her and hear her side of the story and how she ended up with not quite legit lips, but by the time we finish, they will be legit.
Hi, I'm Laura, I'm 29 and I'm from Glamour magazine. So when I initially came, I thought I was coming for what would be a basic lip augmentation, but upon inspection, Dr. Esho pointed out that a lip job that I had done in Australia before I had moved to London in December, there was some residue left from previous lip fillers. He asked me what filler I had actually, or what was actually in my lips, and I had 0 clue. Definitely not something that I thought to ask in the past. I really kind of put my trust in the person that was actually doing it, so it's really interesting to find out that there is so many nuances and so many things involved in actually getting your lips done, which was really insightful. Before I undergo the lip filler treatment, I need to go through what is called the dissolve treatment, so dissolve anything that is actually remaining in my lips so that my lips become legit. And yeah, so I am a little bit nervous. I've heard there's a bit of bruising, but Dr. Esho comes with highly recommended, so I am very excited about the results.
So, you've seen a lovely Laura. Her story is not uncommon, and I think a lot of you are going to empathize with the situation because you're probably looking and watching this now thinking, damn, I'm in the same situation. So watching this video, you're going to see what I do to correct, and actually then there'll be a final video where I actually treat her lips, so her lips are definitely legit by the end of the process. Can you see those cysts across there? So if you look closely, you can see all across the lip are these small sacs, and these are filled full of filler, and they're superficial, so it gives a very lumpy appearance to the lips. So the lovely Laura in the pictures you saw earlier with the lipstick, you wouldn't see this, but with the lipstick off, you would see she's got what we call our lip filler cysts. And this is because either the product wasn't great or the product was injected superficially and therefore formed these small sacs across the lip. So I'm just putting topical anesthetic on the lips now before we inject the product called hyalase. Now hyalase is a synthetic enzyme of hyaluronidase which breaks down dermal filler or hyaluronic acid. And so what it will do is break apart all of those little lip filler sacs that you saw, and she should have smooth and legit lips all again. Very hard. There we go. So now I've popped some of these superficial filler cysts. The best way now is to inject the product hyalase and just to flood it within the mucosa of the lip tissue. Done.
Thank you. So I had the dissolve treatment and I did end up with a little bit of swelling that lasted about 4 hours. I really can't stress how important it is to actually use the ice pack. It makes such a big difference and helps it to go down a lot quicker. During the procedure, it wasn't actually too bad, but there is a lot of pressure that's applied to kind of massage it all out. There's a few steps that are involved, so there was a bit of bruising that appeared the next day, both on the right hand side and the left hand side of my lips. So it's actually really bizarre because initially I didn't realize there's anything wrong with my lips, so I have usually quite reasonably full lips, but it's crazy how after the procedure I actually can feel what was there in the past. So it was a bit lumpy, and now you know that you kind of naturally feel it with your tongue, but now it's definitely completely smoothed out and I can tell the difference.
So you just heard Laura's dissolving experience, and what she experienced is quite common. Usually when we do the procedure, there can be some discomfort. It can sting a little. There's a bit of pressure when we're massaging the lip itself. So it's key to ice and make sure you go straight home as your doctor has advised. The other part is many times people don't realize that something has gone wrong with their lips. And despite doing the best research, they just think it's normal because it's the first time they've had this. So hopefully by watching this video, you can really see what it is to have legit lips. So the dissolve has worked. All of those nasty little lumps have gone now. Your lips feel a lot better?
Yeah,
better. Doesn't feel lumpy inside, does it?
Yeah, no, not at all.
Good. Okay.
Very smooth.
Perfect. All right, and open this wide, you can just see. So now you've got good sized lips, all right? So really for me, it's just about defining the border, making the extra lip and a bit of a dip in the actual lip itself.
And what product are we using?
We're going to be using Juvederm Voluma. Now, Juvederm is a company that produces a lot of products. It's by a company called Allergan, and it's one of their biggest brands. Voluma is part of something called the Vicos range, and actually it's a gel that is very similar to our own rheology of our own lips.
Okay.
That's why when we inject it, it's quite smooth and soft, and with the correct technique, you shouldn't feel any lumps or bumps in it at all.
Thank you.
You've got a nice natural lip anyway, so what we've just done is refine that.
Yeah.
We've defined the borders, we've got a bit more body to the top lip itself,
Yeah.
although your bottom lip was always okay,
Yeah.
and we've dipped the middle part slightly a bit lower.
Yeah, absolutely love them. Really, really cool.
Yeah?
Yeah. So I've just had my lips done, and the process was actually pretty seamless. It was fairly pain-free, and the results, I absolutely love them. Like in the past when I've had them done after the procedure, it always feels like they're a little bit balloon-like. I don't know how I feel about them, but I can tell already that my lips are really just an accentuation of my existing lip, which is exactly what I asked Dr. Esho for, and I'm really, really pleased with them. So I will be icing my lips for the rest of today, and I will be back in approximately 2 weeks for my follow-up consultation. Dr. Esho will be doing any top-ups if need be. But yeah, I'm really, really excited about the results. I'm excited for the swelling to go down and to see what they look like.
We get that.
I never cry.
We did get that.
It's lies. Is it filming? It's all a lie.